Good afternoon and welcome to the Future of Healthcare, the series of talks that are being brought to you today by the Department of Health Abu Dhabi. I'm Brandy Scott. I'm the host of the Business Breakfast on Dubai Eye 103.8. And this afternoon we are talking collaboration. And if you'd like to collaborate with us, you can take a stool, move a little bit closer so that we feel a bit of participation with the audience. It's not often you say move a little bit closer in the last 2 years, is it? Apart from each other, but closer to us. How is that? We're talking collaboration. After 2 years of pandemic, we are looking at what we have learned about working together and what we could have done better. Now, the pandemic has changed the way the public, the private, and the non-profit sectors work together, and what that all means for the future of healthcare. And we've got around 40 minutes with you today. And then if we want, we can take a few questions from the audience at the end. But we're going to jump straight in and introduce our panel extremely quickly. And what a panel that we have as well. I'm going to run through the expertise that we have at our disposal, and I'm not going to do any of them justice. You have LinkedIn, if you'd like to see their whole bios and indeed connect. On the end there, we have Lena Jaluka, who is the Public Partnerships Manager for UNICEF in the Gulf. She brings 24 years of experience in strategic partnership and resource mobilization to our panel. UNICEF has been instrumental in the COVAX vaccination movement and working with Abu Dhabi on that, which we will be discussing. And next to her, Ahmed Al-Bastaki is the Chief Strategy Officer at RAFID, which is the UAE healthcare supply chain entity. Ahmed himself has 30 years of experience in this sector, leading major healthcare operation projects in terms of logistics and procurement. And directly next to me, a man who's been a voice on my radio station several times, Dr. Omar Najm, is the Executive Director of the Executive Affairs and Special Projects Office at the Abu Dhabi Health Authority. He is a member of the core Abu Dhabi COVID Gold Command team. So let us talk collaboration and the challenges that we had where everyone had to learn very quickly to work and play nicely together. Ahmed, if we start at the beginning of the pandemic, which needed an immediate real-time response without an awful lot of data, how quickly did you have to act? What kind of time frame did you have to take decisions, get budgets, and start working together?
Hi, everybody. Actually, at the beginning, it was the start of pandemic when we start to see it here in UAE. It was in Arab Health, during Arab Health 2020. We noticed the queue on the pharmacy for the masks, and so we understood that later that there is a need, and the impact was beyond what we, despite we were prepared. We had the preparedness, we had everything available, but the impact was very big because it affected all the flights, affected the logistics all around the world. There was a shortage of all the PPEs, shortage at each level of requirements for hospitals, including ventilators. That was the biggest challenge also, and the medication. So what was the decision is to go to the source and to get ready and prepare ourselves. So it was sourcing from the manufacturers, from the countries, and accordingly, what we noticed that within 2 months, we were almost ready for the pandemic. We are very well equipped with all the equipments, pharmaceuticals, and the PPEs, the most important that time. But decision making, I mean, in some situations, it could take 4 to 6 hours from up to down. So it was very smooth. Everybody was involved. Until today, the same situation. Last 2 years, till today, the decision, the hierarchy of the decision is really quick. It can go very fast, comes back very fast.
When we talk about collaboration with vaccines, which is going to be a major focus today, we usually think about distributing the vaccines. But at the very beginning of the pandemic, we were talking about collaborating on vaccines that didn't actually exist. Dr. Omar, do you want to tell me about Abu Dhabi's role in getting those vaccines to the point that they existed to get them out there in the first place?
So I think a few things to bear in mind when we are looking at the current pandemic that we lived through over the last 2 years. One of the key elements of it is we are living in a time that none of us has experienced before. So you can say it's also one of the largest crises to affect the humanity in our lifetime, and we're hoping that it wouldn't happen again. So we realized within 2 months of the start of the pandemic, as Ahmed was saying earlier, we started realizing the signs, and we felt it in UAE around end of January. By March time 2020, we started also looking at vaccines as one of the key enablers to get our society, our economy, and the wider world out of this pandemic. So what we did is we scanned the world of where development and clinical research and explorations of vaccine are happening. I remember spending days no end talking to academia, talking to companies, talking to even individuals who are at their home are looking at something specific, talking to different governments about what's the work happening around the vaccine. Obviously, there are plenty of them. I think by the latest number, there are about 220 vaccines in development. Some of them passed the mark, some of them are still to do that. And when we looked at that, we started realizing that the new technologies or the new terms being used, which is the mRNA, the viral vectors, not only didn't exist before, but the capacity to handle them is very scarce globally. So we started looking not only at when the vaccines are going to be available, collaborating with different developers, different companies, different academia, on supporting their research, supporting a pre-purchase agreement, supporting their manufacturing, but also working in parallel with the likes of Rafid, with the likes of the Abu Dhabi ports, with the likes of Etihad Cargo, on how we're going to transport, store, and distribute that vaccine safely. If you look at vaccines in general, they require specialized conditions in the best of times. So 228, handled with care all the time. Now you are looking at another dimension, which is -80, -20. To achieve the safe transportation, storage, and distribution, you need to collaborate across every single steps involved in the long supply chain from where the vaccine gets manufactured all the way to where the vaccine is needed, being it in one of the top Himalayan villages, or being it in rural Africa, or be it in the middle of Dubai or middle of Ohio. You still need to make sure that that vaccine arrives in the right time, the right place, to the right person, and most importantly, in the right condition. And that's where we started collaborating. We started collaboration for the benefits of UAE, and then we realized we have a capacity to offer the world, not only in terms of expertise, but also in terms of the infrastructure that exists in UAE. And we established the HOPE Consortium, and we took it from there.
Before we get to Lena, who is involved in both the HOPE Consortium and COVAX, Ahmed, do you want to explain to us what the HOPE Consortium is, what it was set up to do?
Yes, thank you. HOPE Consortium, it's a coalition, was established under the sponsorship and leadership of Department of Health. It consists of all the players who can guarantee the delivery of the vaccine from the manufacturer to, as Dr. Omar mentioned, to any village, even in Africa or on Himalaya, wherever. So what is it consists of? For example, we have Rafid as a procurement arm and contractual arm and financial arm in collaboration with DOH. Then you have Etihad Airline, which is the air freight logistics, Etihad Cargo. That's what they do, all the deliveries on the freight. Then we have Ediport, where we keep all the warehouses and the logistics part around it, and delivery and transportation. We have Bawabat Maqta, which is the technological arm or the data visibility arm for this provides the platform for this consortium. And also we have SkyCell, where is all the content to make sure all the vaccines moving within the required temperature. It is kept on the flight, on the land, on transportation, all the way, and track it. So these all members come together to create a Hope Consortium, where is working together, for example, moving a vaccine from, for example, from China. It comes to the airplane all the way, kept in the required temperature, up to the warehouses, then making sure it is kept at the 2 to 8 or minus 80, wherever required, and then delivering it. And now, even lately, we start to add on Hope Consortium is another scope added, which is with Biomedica, that also apply vaccinating and administering the vaccines, not only any place out of country.
Lena, tell me what the Hope Consortium has meant in practice then for UNICEF, because you work very closely with COVAX, which is the WHO, the giant global vaccinate everyone, no one left behind initiative, which the Hope Consortium has also been helping. Tell us how all of this works in practice.
So maybe I can talk a little bit about how UNICEF ended up being in this position in the first place. It's really no coincidence, because UNICEF is the largest vaccine buyer globally. We purchase some 2 billion doses of vaccines. This is for routine immunization, for outbreak response, etc. And we help deliver those vaccines to children all over the world as well. And when the pandemic hit, UNICEF, of course, was called on to lead on behalf of COVAX, the effort of procuring and then distributing the vaccines. And we are doing that on behalf of, and I'll just make sure I get the numbers right, 92 low and middle income countries. But we're also supporting the procurement for more than 97 upper middle income and high income countries as well. So you can imagine, I mean, we're talking about, if you add up all those numbers, we're talking about 4/5 of the world's population. It's a massive, massive number. Just last week, on the 15th of January, UNICEF delivered its billionth COVID-19 vaccine. And this was a huge moment for us, as you can imagine, but we didn't really have much time to celebrate because we still have much more to do. And because of that, partnerships like the one we have with the UAE government and with the Hope Consortium become absolutely crucial. This is not something that UNICEF or any other entity can take on its own. I mean, COVAX needs all the support it can get, and we were lucky that in the UAE government and the Hope Consortium we found that partner.
While you've got the microphone, do you want to tell us very quickly what the pandemic has meant for children?
How much time do I have? In addition to disrupting the health systems all over the world, disrupting education for a very long period, some 630 million children have been left without school or had their education interrupted for the duration of the pandemic. I mean, we're talking about a huge loss of education opportunities. Children's literacy, numeracy has gone down significantly. Children have missed out on nutrition that was provided to them through their schools. Mental health has become a huge issue for children and young people across the globe. So really, it's a multidimensional crisis that we are having. In fact, it's the biggest childhood crisis that UNICEF has faced in its 75 years of existence.
So let's talk about the challenges of tackling the part of that COVAX and the Hope Consortium and this collaboration can. Let's talk, we've mentioned temperature quite a lot here. Can you give me some practical examples of dealing with temperature issues in different countries? Anybody? with people with different levels of training, of equipment, of freezers to them. Who wants to paint a picture for me of what this has actually involved?
I'll take that question, but I'll come to the temperature one, but I'll just want to highlight a couple of other challenges. So one is building on what Lena was saying. One of the biggest challenges that we need to tackle is the mindset of different areas around the world, different countries around the world, which is there is a need for an acute realization that we are in this together. Nobody's going to be safe until everybody is safe. The pandemic started with one person, and unless we go back to zero, it can't re-emerge again and again, and we are in the same place that we are having since last December, which is the emergence of a new variant. Second is we need all the resources together, and until we open our resources and we start collaborating with each other, the challenge of what UNICEF is trying to do and the impact it's having is going to continue to linger even after we get rid of the virus. The virus is a healthcare challenge by itself, but it will have many ramifications. We're probably feeling it now on economies, on societies, and even stabilities of countries nowadays. And some of it is being felt now, but more of it is going to come sooner. There is in the US, they are looking at a record inflation happening. In the UK, they are saying by April, they start realizing the economic impact. And if you look at this and try to project it on smaller societies, smaller communities around the world, then you will start having the feel of the impact or the real impact of this pandemic. Now, around the temperature, I'll come to that, and I promise I'll answer that. So, minus 20 or minus 80, not only some people probably around the audience, and me included, did not hear that such temperature exists in the first place. So I think that the furthest I've experienced is about minus 2. So minus 20, minus 80, when we started looking at mRNA, we started talking just to understand how you get to that temperature. We looked at fish importers. How do you get the fish from Chile to UAE? What temperature do you use? We talked to people who works in the oil and gas to understand how you get the gas to be liquefied and you put it in the ship. Again, it's something that we haven't experienced. So, and this is us working in healthcare, saying we didn't experience this. Let alone the person who's handling the vaccines on the tarmac in an airport. Let alone the person who's handling the vaccine at the clinic in the front line. How do you handle it? Do you wear gloves? Do you not wear gloves? You don't know. So all of this need to be looked at very carefully. Understand what the training involved, because nowadays the guy who's working in the airport is handling minus 20, minus 80 every day, and need to look at it and know how to handle it in order for the vaccine to arrive in the right place and at the right temperature. Because you have to remember, the vaccine itself is a liquid in a glass. It does nothing. It saves no life. What saves life is vaccination. You need to get that liquid into somebody's shoulder and to somebody's system. So vaccine doesn't save life, vaccination does. And part of that is to get the supply chain all well and sorted to the absolute last chance of failure. You need to eliminate all of that to get as much of the world vaccinated as soon as possible.
Ahmed, how do you deal with the human aspect in that? People often are the weakest link in any chain. What have you had to do to train people on the ground in different countries to make sure that what Dr. Omar has said happens?
Exactly. Adding to Dr. Omar's points, it's creating or developing the vaccine. It was really challenging situation, but again, once the vaccine is delivered by the manufacturer, okay, it came and there is FDA certificates, everything done. You delivering this vaccine again, taking it to where it needed, that was the second challenge. Many countries we noticed that the idea of RAFID came when it started. we were thinking of, it was in April 2020 when we started to think about, okay, how this is going to finish, this pandemic. At the end, everybody needs to be vaccinated. That time we were talking about, is it 1 dose? Is it 2 doses? Is it pre-filled vaccines, or is it vial? All that, these questions to be answered, building up around it. So we understood that we don't have that capacity. We needed to work with DOH and all other players here to find out, okay, how we can work it out. That's where the logistics, RAFID DC, which is a part of the HOPE Consortium Distribution Center, is used. But the result was that we were looking for 20 million, that making, okay, if it's 5 million, we can reuse it. No, we ended up having location for 100, the capacity for 120 million vaccine in one time, which can be used up to 6 billion. Doctor, if I'm not, that's his calculation it was. So that's a big capacity. And accordingly, we were like, okay, now we see that it's not only helping UAE. Now we can extend our help to other countries. When we start to see around, there is many countries, they have no availability at all. And you have to build all the logistics around it. Think about it, country by country. Each country has its own situation. Some countries, they can receive it in hospitals. Some countries, they have to go by tent. And you have to stop the airplane with the Sky Cell containers, using that for a few days so you can use it one by one until everybody is vaccinated. That was one of the biggest challenges I can see, and we overcome today with all this integrated team and all the collaborations from everybody, from government, from NGOs, from private sector. Accordingly, I feel today we are really going on a right direction, but again, it's gonna get there, and everybody hopefully not only will be vaccinated.
Is belief about what should happen with the virus an issue with collaboration? We've got some countries pursuing a zero COVID, an elimination strategy. Others were looking at herd mentality in the beginning. Some, have gone to the sort of live with COVID situation. How do you collaborate when there isn't sort of one global goal almost?
I mean, you adapt, right? Because UNICEF has years and years of experience of working with very different contexts. So through our response to the COVID-19 pandemic right now, we're working with governments like Sweden. We're working with countries like Jordan and Turkey and Egypt, but we're also working with Zambia, Burkina Faso, Sudan, where the resources available and the readiness of the country to receive the vaccine is completely different. So there's a lot of, it's a very, it's a multi-layered issue, because there's the issue of vaccine hesitancy, acceptance, etc. There's also the issue of the country's readiness to receive those vaccines. There's the immense logistic challenges that come with the vaccine delivery, where partners like HOPE Consortium are really supporting UNICEF and other players. But the thing is, regardless of which country you're looking at, to come back to Dr. Umar's point, no one is safe until everyone is safe. So you have to find a way to work with each country depending on its own existing capacity. And UNICEF is doing a lot of work, particularly in low and middle income countries, to make sure that their capacity of the health system is boosted so that they're able to receive the vaccines, and then that they're able to deliver those vaccines to the people who need them. And
Which brings us to the issue of vaccine inequality. How do we tackle that?
Vaccine inequality is, of course, the biggest concern for UNICEF and the other COVAX partners, because we really need to make sure that this picture that we have at the moment, we've delivered 1 billion doses. Most of those have been to low and middle income countries, but we're still talking about countries that haven't received a single dose. Nobody has actually been vaccinated, or the numbers are so small that it's negligible. And without having the vaccination of the majority of the population, it really, it's going to keep happening, and then you have the new variants that you need to address. So it's really a big challenge for us, the issue of vaccine equality. And the only way we can do that is through partnerships. We need all the support we can get. We need governments to share their vaccine doses. We need governments to contribute flexible funding to organizations that are working on this response, like Gavi, like UNICEF, so that we are able to purchase the vaccines that are needed. And then we need partners like the HOPE Consortium to help us deliver those vaccines to the countries where they need to be given.
Are governments doing that?
Governments have really come together. Everyone, it has been a global effort. But I think one of the lessons learned, and we'll talk about that perhaps a little bit later towards the end, one of the lessons that I think we have learned is that you cannot be prepared enough, right? I mean, this is coming. This is not going to be the last one. So it's just a matter of doing this collectively, all the governments of the world coming together with the private sector, with the public sector, to make sure that we are all very well prepared for when something like this happens again. And we're not out of it yet, right? I mean, we're really still struggling. I mean, the impact on some countries, for example, Tonga, they've just had a volcanic eruption and then a tsunami. The country has already been in lockdown for 2 years because of COVID-19. You can imagine the impact that has had on children, on families there. And on top of that, now you have a natural disaster that they need to deal with. So, I mean, there's really so much more that we need to be doing, all of us together collectively, because the needs vary from country to country. I think some countries, for example, here in the UAE, we are blessed. We have very strong health systems that can adapt and that can respond very quickly. Other countries are not so fortunate. So we really need to pull each other up and make sure that we are responding to it as a global collective effort.
Ahmed, Dr. Omar, does anyone have another comment on vaccine inequality before we do move on, as Lena said, to what we're learning?
Again, a question?
Vaccine inequality.
Yeah. I mean, what today we are doing here, HOPE Consortium, even it's helping for the... If countries not getting vaccine due to incapabilities, shortage on the infrastructure, again, RAFID is there. For example, with also Department of Health all together as a HOPE Consortium. The HOPE Consortium, what it does, it helps in that inequality and availability of the vaccine and deliver it to any location, working with UNICEF, working with DOH, working with the government. That's one of the achievements, and we are very glad of. Today, we were able to deliver 250 million vaccine around the globe, up to 50 countries. So this, I will believe that this is a huge achievement of HOPE Consortium and help the world to come over this pandemic.
Dr. Omar, what could the world have done better?
I think if you look at the different countries and their response to the pandemic globally, you can see that the key success factor that relates to the success of tackling the pandemic is the collaboration. And they're appreciating that this is a global pandemic that needs a global solutions. Whatever the solutions that you're going to implement at a local level is going to go as far as is the world safe yet. So you can close your borders, you can provide the best of treatments, you can say I'm going to keep all the vaccines to myself, but at the end of the day there is no escaping from the fact that this is a global pandemic. I think the world could do better, and I think the UNICEF, WHO is doing it. So the issue around vaccine equality is no issue about getting the vaccines to the different countries. There is an issue about manufacturing. 80% of the manufacturing is happening on a handful of places. Surprise, surprise, more than 80% of the world lives somewhere else. And you need to get these vaccines to these places. Second is, we talked a lot and we had the experience of getting these vaccines to low or low middle income countries for a long time now. But the infrastructure goes beyond just needing 228. I think UNICEF has realized that most of the vaccines being developed need a technology that goes beyond 228. And the countries that deserve to receive these vaccines are not capable to to manage to receive these things. And that goes even beyond that. They don't have an infrastructure in terms of electricity, in terms of security to manage these vaccines. So we're going into even deeper situation of the inequality that exists in the world today. And we need to all ask ourselves, how can we help? Not only at government levels, but even at society, communities, and individual level, in order to get to the right place.
So let's look at what we have learned from the pandemic and the collaboration within it. You mentioned the new mRNA technology there, which has really been brought to the forefront and tested in this pandemic. Let's start there. What have we learned about its limits, its possibilities, its capabilities?
So, as Ahmed was saying earlier, what you have after 10 months of the start of the pandemic is several safe and effective vaccines. This is a triumph for science, a triumph for the human endeavor. And now we need to make that even equally triumphant in terms of equity to vaccines and even pushing the technology further. So mRNA today is being used for vaccine, but mRNA is here to stay. mRNA is going to be used for cancer treatment, is going to be used for immunological disease treatment, along with certain other technologies, the viral vector technologies, the monoclonal antibodies technology that came to the fore to address lots of problems that we have in terms of pharmacological solutions for conditions and diseases we have today. So it's going to be continued, and the world need to be prepared to use these technologies through an infrastructure that need to be in place to handle it in the right way. mRNA, there are many other technologies being used. We need to open our mind. We need also to learn from the processes that we implemented during COVID time, and how can we replicate that into other areas of what we deal with diseases or healthcare in general.
What have we learned about the physical practicalities of moving things from A to B that will help not just with pandemics, but healthcare in general? Dr. Ahmed.
What we learned today here is that working with all together, for example, government, private sector, NGOs, all of them, they need to collaborate and open the channels among each other. We need a lot of, we learned a lot of decision making and flexibility around it, and having the visibility. This is very important. You don't know what is behind what's happening, and if you don't have visibility on the laws, the regulations, the logistics, these are very important. And I think what we learned today, how to overcome these unknown situations, being prepared. Advanced planning is very important. We do advanced planning on daily basis. I think we are in touch with Dr. Omar maybe 2-3 times, sometimes a day we met, just to be prepared for not only that vaccines and what you're doing, but also what in HOPE Consortium, what we see today, how we can expand the scope of HOPE Consortium, not to go only vaccine, go for others, for example, COVID-related PPEs, COVID-related medications, and so on. So that's, I think, one of the most important, that what we learned after 10 months. I think we completed 1 year now. So, so that's I think today we are working on it, and we are expanding on that.
Lena, what's been the biggest takeaway for UNICEF so far?
I think the thing that was most striking about this pandemic is the broader human impact of it, right? Because when it first hit, you might be tempted to think this is a health crisis, but then there are so many other dimensions to it. The impact on the lives of children around the globe has been profound. I mean, just because of the pandemic, we've had 100 million children fall into multidimensional poverty. This is just in the duration of the pandemic. This is a staggering number. I mean, I don't think we've seen this level of decline into poverty in our lifetime. So these are the kinds of issues that we are concerned about. These are the things that keep us up at night. The fact that children have missed out on 2 years of education, the fact that it's going to take them so much longer, and sometimes it's not going to even be possible for these children to recover the loss of education that has happened. So these are really the things that we need to all be looking at. How can we recover faster? How can we make sure that children's mental health is addressed adequately? Make sure that they're getting sufficient nutrition that they've missed out on because they're not going to school, etc.
Dr. Tedros from the WHO said today that we shouldn't assume that COVID will be over with Omicron. He said that the conditions were basically perfect, and here he is talking about vaccine inequality, for a new variant to emerge. Are we prepared for that? Don't fight over it.
Please go ahead, please.
Yes, of course. I hope he's wrong, but we are today much 10 times more prepared. We are much have knowledge about how to deal with it. We know how to advance plan. Any changes happening, we monitor everything on daily basis, watching. In case that's, it's a possibility and high possibility to happen. So it is in our plan. It is on our radar all the time, and we are ready for it. In having the capacity, expanding the capacity. So that's what we are talking about. The learning is to have more visibility and have more scopes. So we are not just talking about vaccine, any other related to COVID or other pandemic in future. We are ready for it.
So what's the focus now, Dr. Omar? What's your gut feeling about where we hopefully are with the pandemic, and what's your priority?
So I think for UAE in general, we are in a good situation. And I think it's because of what Ahmed was saying earlier and because of what Lina was saying earlier. It's the planning, the ahead planning. So in dealing with the pandemic, we had 3 things that most of the countries around the world did, which is focus on prevention, which is stopping people from getting infected in the first place. So that includes the massive testing exercise that we usually do every day. That include the vaccination, that include the education, that include on identifying patients early when they get infected so as to break the chain of infection. The second is about the treatment and trying to provide the right capacity and the right capabilities and the innovation to support the best treatment outcome when somebody gets infected, especially for the individuals who are at high risk of getting severe disease. Last but not least is how can we prepare and plan for the next one. They go, so we always, in UAE, and that's proven, it's planning for the worst, but working for the best. So your planning is always failing if you think it's going to be better and better tomorrow. You need to plan what's your capacity, capabilities, and innovation that need to be in place just in case a new variant has hit. At the same time, all of this, we're living through a global pandemic. There are so many variables that keep changing every day, not because of the work we are doing, but because it's a global pandemic. But also not forgetting the ambitions that we got from the last 2 years, the aspirations that we planned in UAE going forward. You look at the newspapers over the last year, over the last 2 years, it's not filled with news about COVID. It's filled about ambitions of doubling the industrial output of UAE. It's about going to Mars. It's about planning to go to Mercury. It's about sending the first man to the moon. It doesn't only provide help, but it also gives you a glimpse about what's the aspiration of this country. If there's anything that UAE has come from over the last 2 years, is the confidence in ourselves to tackle whatever life is going to throw at us. And we're hoping that we can take that confidence to help in our humanitarian efforts that we did, and we want to continue to do on bringing better place for the wider world.
Well, that's the absolutely perfect place to leave our conversation today, and bang on time as well. See, this is what 2 years of intense procurements and logistics will do for you. You'll finish to the minute. Thank you very much, Dr. Omar Najm, the Executive Director of the Executive Affairs and Special Projects Office at the Abu Dhabi Health Authority. Next to him, Ahmed Al-Bastaki, the Chief Strategy Officer at the UAE Healthcare Supply Chain Form and Entity Rafid, and Lena Jaluka, Public Partnerships Manager for UNICEF. Fortunately for us, based here in the Gulf. Thank you so much, all of you, for sharing that with us this afternoon.